I had asked on Facebook if any of you guys had any questions for someone living with cancer, or if there's something you think I should bring up in cancer chats. A couple of you guys came through, and let's chat about those questions now. I actually got more questions than I can handle for one video, so today we're going to look at Shellys questions. And the first one was, did you know you would have more than one surgery? Now, I don't know if this specific question was just dealing with my breast, or if that's how it goes for cancer patients, but here's the easy answer. No, I had no idea how many surgeries I would have actually. I understood that we would be doing a mastectomy, and we did a radical mastectomy just on my left side. That is an interesting story in itself. There's a couple steps sometimes before you just go in and have your breast cut off that they do. And one of them for me was that they found cancer in my lymph nodes. And so during an ultrasound before surgery, they had put a little bitty clip. I mean, I can't even feel it. A little bitty clip in that lymph node. So before I actually went in for the mastectomy, what they wanted to do then was to put a wire into that clip. And all of this was supposed to help track which lymph nodes had cancer. If you want a more detailed description, go find a really good webpage that describes sentinel node biopsies and sentinel nodes dealing with mastectomies and how they use them. Long story short, finding that clip again was really hard. And the idea of putting the wire in there was maybe, in my mind, the worst part of the surgery. I ended up in some weird, funky position in a machine that would do a mammogram because they were trying to find the clip. And then they had to stick a wire through my back into that lymph node. It was awful. It took like half an hour to get this in place. And then it didn't even actually work for what they were hoping for the surgery. So, but hey, I certainly don't mind every efforts to get the cancer out of my body. But I guess if you would have asked me, I probably thought I was done with surgery at that point. And again, as far as like actually dealing specifically with the breast cancer, I was. I didn't have reconstruction, which actually kind of gets into the second question from Shelly. I didn't have reconstruction and it wasn't offered to me. See, if you'll remember, I have inflammatory breast cancer, which means it's a little more invasive than some of your typical cancers. It's in the skin as well. So what they took from this area was skin and muscle and fat, and I'm very concave over here. Like you can feel my rib cage in there pretty easily. They had to take all of that out, and there was nothing left to just do like you stick an implant in the skin that's left there. I just didn't have that. That needed to go. And so for me, I just haven't done reconstruction at this point because I had to get through healing up from that surgery. And then I had radiation. And then as far as having another surgery, I had a hysterectomy as well. For me, having a hysterectomy wasn't necessarily on my radar as having another surgery. But because of the type of cancer I have, which I have triple positive cancer, which means that my cancer is feeding off of estrogen, progesterone, and HER2. One of the best ways to control the estrogen in your body and to be on certain drugs that should help your body not have a reoccurrence of cancer, a hysterectomy was the easiest way to go. For me, I like that better than constantly taking meds or a shot that were going to suppress the estrogen. I was looking for, let's say, the path of least resistance. But I guess I can back up before all of those, and I don't know if we really get to count it or not, but I also had the surgery getting my port in, which, hey, I can even show you guys my port. Well, apparently I can't because I'm hooked on my shirt. This right here, this is my port. It doesn't really look like any big deal, just, you can barely even tell. It kind of sticks out of my chest a little bit. But getting my port was the very first thing we did, because for me, again, I didn't have a choice here. Some of the chemos that we were going to be running had to make sure that they stayed within your veins, or else they could cause necrosis in your body. So I didn't have an option to get a PICC line or just have a normal IV. I was told I needed a port, which I will discuss in another video and I think was a great thing. I'll tell you a quick funny story about that though. I was pregnant at the time, and so while I could have been put to sleep, they opted not to. So I just got numbed up in this area, and I got a couple shots of fentanyl as they were putting the port in, because it actually runs up the side of my neck and then it runs over to my heart. But it's kind of funny. I'm laying down there, and typically people are put out for this. And at one point the doctor said, "Hey nurse, how tall is this patient again?" And I'm assuming that's because they needed to know how long these, the tubes are that are running over here, the catheters. And I was like, "Hey, I'm 5'6". And the doctor goes, "Oh my God, I forgot you were awake down there." Which, I don't know, kind of cracked me up. I think I scared him a little bit, but got the port no problem. So those are the surgery questions. The other one was, how do you decide if or what type of reconstruction you're gonna do? And like I said, again, for me, that was a little bit of a foregone conclusion that we couldn't do stuff right now. I am certainly at the place where I can do reconstruction now. My reconstruction is a little more involved than some of the more less complex procedures. For me, like I said, there's nothing here. So they would actually do a cut about hip to hip, take skin, fat, blood cells, you name it, from my stomach, which I have plenty of fat cells to donate these days, and use those to reconstruct a new breast. I just can't bring myself to do it yet. While I find it a little bit odd to be lopsided, I'm just not up for another big surgery right now. And that would be actually the biggest surgery I've had to date. And so for right now, I'll stick with the prosthesis or just having one breast. That seems easier to me than going through that surgery. And then the last question from Shelly was, did you ever imagine the amount of decisions you would be asked to make? No, but I love that question. I'm a year and a half into this, this journey with cancer. And so I'm a giant advocate of people doing their research, of understanding what their options are, of asking your doctor questions, of being a pesky patient if you need to. And I found out that really most doctors don't mind. But no, I just had literally no idea that having breast cancer would spill over into so many other parts of my life, and there'd be so many decisions to make. I mean, even down to, I think, and this is more personal to me than some other stories, but we lost our baby girl when I was on my fourth treatment, my fourth chemo. And once we realized that our baby girl had passed away, the decisions to make within like the next couple hours of, do you want to stay at the hospital? Do you want to go home? Are we going to induce right now? Are you going to have your baby cremated? Are you going to have a burial? Are you going to have a service? Do you want time with her? Do you want to see her? Do you want pictures to keep from this? What type of pain management are you after for right now? I couldn't even think straight. I had some amazing nurses, and my husband was super helpful with having to go through that. But that's a little snapshot of how many decisions had to be made in a short time. And I think with cancer, it's maybe not that intense all the time, but there's a lot of decisions to be made. There's a lot of questions to be asked. There's so many new things, which is awesome and great. And I'm so excited there's so much research in breast cancer. It has probably saved my life. But the amount of life and death decisions that you make should probably alarm you, and at some point kind of becomes the norm, which I'm not sure if that's a good thing or bad thing. You probably need to have some desensitization to it, to not be so overwhelmed all the time. They also make great meds to not be overwhelmed all the time. I'm a big fan of the anxiety meds. But that idea of big decisions, I think, has to kind of become just part of life when you're dealing with cancer, and especially metastatic cancer, because that just doesn't change. But Shelly, awesome questions. Thank you so much for writing on Facebook. If there's something else that you guys would like me to answer, please type it in the comments. Find me on Facebook. Let me know. I'm absolutely happy to answer questions. Again, they're just from my point of view, my perspective, and my story, but I'm always happy to engage in some dialogue. So thank you, Shelly, for sending in some questions, and we'll even get to some more next week.